I provide individual therapy services in an empathic, non-judgmental environment, and I allow myself to be open to whatever the individual is coming in with. If it's a concern, it doesn't have to be a diagnosable mental illness. It could just be stress or anxiety about something, and I help figure out a way to get them through it. Whether it's building coping skills, whether it's just coming in and talking for an hour because you had a stressful week and you have no one else to talk to, or the people that you talk to don't give you good feedback, or they judge you based on what you're telling them, and that's not what I do. It can also be more intense in terms of working with people that are grieving, that recently lost a loved one, or dealing with a scary diagnosis, maybe a physical diagnosis or something like that. Also, some more severe mental illness like bipolar disorder, schizophrenia. I have experience with that, and depending on the individual and what they're presenting with, you know, the first session or two is based on building rapport, getting to know each other, creating that trustful environment. It's very important. Most people aren't just going to present their deepest, darkest secrets the first time you meet them, and that it's a process and it has to build. It's genuine, and obviously being genuine, people can recognize when a person is going through the motions or when they're really interested. So being a good listener, obviously, giving good feedback, these sorts of things are important in the first couple of sessions. And then to make it a little more tangible, we can develop a treatment plan. We can target specific issues, concerns, and develop, you know, evidence-based treatment to work on resolving those issues. I think that because there is still a stigma around mental health counseling therapy, that people struggle with the dichotomy of wanting help but maybe not wanting to admit that there's something wrong, or feeling like I'm somehow quote-unquote crazy because I have to go talk to somebody, or because I go see a therapist. But I think that's changing, and I think that having the services available at a place like LoCicero Medical Group, where it can be more of a convenience, like, hey, we have someone that you can talk to if you're interested. You don't have to go make a separate appointment. You don't have to go through that whole process. Can be huge because there's the access, and I think access is a pretty big barrier to people getting good mental health treatment. In some areas it can be very expensive. In some areas it's just not there. So my experience is once a person meets me, walks in the door, and we talk, the stigma goes away. They understand that it's beneficial. They usually feel pretty good after even the first session. And you've convinced the person more or less that they made the right choice and that it's helpful.